Hey guys, good afternoon or good evening wherever you are. I'm going to discuss urine colors. The color, something we observe every day. Sometimes the color gets different for some reason, as we shall explain here. This is the average normal transparent yellow color. It can be very pale when you are well hydrated, drinking more water, and it can be dark yellow or amber yellow, which is also normal in many cases. Fasting, for example, you are not drinking enough water, some diseases like diarrhea, vomiting, or it can be normal, just you didn't drink enough urine. Red or pink, usually not normal. It's either due to disease or you ate colored food. This urine, very faint urine, this is also a result of overhydration. You drink more and more water. It is not harmful to drink more water because the excess water will be excreted with urine. Urine will become very pale yellow or like this one, colorless. Another color which is orange color, it can be normal cases of dehydration, you don't drink enough water, or indicate a disease, or due to eating some colored foods. Can be caused by foods, medications, medical conditions, or dehydration, not drinking enough water. Here also red color or pink, either due to eating colored food, due to disease, hematuria, that result in excretion of hemoglobin, red blood cells in the urine. Not all cases of hematuria will have a red color. Red color when red blood cells enough to be visible by looking at the urine, but sometimes it is not visible except under the microscope. This is called hematuria also. Dark brown color is also a condition due to some disease, especially liver disease or bile disease, and it can be also due to food, due to medications. Another color, blue-green color. First, physiological due to eating colored food or due to taking certain medications or due to a disease, medical condition. Next, this is not a change in color, but it is a change in transparency. Normal urine is transparent. Sometimes it becomes cloudy or murky due to presence of a material inside mixed with the urine. More salts or crystals inside the urine make it cloudy. Urinary tract infection, dehydration can make it cloudy. Here is a list of some conditions where the urine color is changing. Hematuria makes the urine pink, red or brown in color due to presence of red blood cells mixed with the urine, excreted in the urine. This is seen in many conditions. Some of them is physiological, called marsh hematuria. Marsh hematuria seen after harsh exercise. That's why it is called marsh, seen frequently among soldiers after a day of heavy exercise. It is seen in conditions like hemolytic anemias that result in destruction of red blood cells and excretion of hemoglobin and red blood cells in the urine. Dehydration for any reason, it can be dark, cloudy, orange, brownish, so it is darker and concentrated. We see this if you are not taking enough water or losing more water like in vomiting and diarrhea. Liver disease can result also in brown, dark brown urine or tea-colored urine due to excretion of bile pigments in urine. Here is a disease resulting in dark brown or reddish brown urine due to destruction of muscles, fibers and excretion in the urine. It is called rhabdomyolysis. Porphyria, another disease, a genetic disease where there is genetic disorder of hemoglobin, of heme, not hemoglobin all. Hemoglobin is composed of two parts, heme and globin. So this heme is defective, resulting in porphyria condition with dark or dark brown urine. Physiological due to foods or as a result of taking some medications. It can result in red, pink, orange, pink red, orange red, deep yellow. All these colors can be a result of taking colored food or taking some medications. Before we finish, we need to ask how many times a normal adult pee per day. It is usually between 4 to 8 times a day if you don't hold. Of course, if you hold, you can be only once all the day. But if you just go to urinate whenever you feel the desire, you can do it 4 to 8 times a day. Usually you excrete the volume, which depends on how much you drink water. You drink more water. If you are a normal person, you be more daily. Composition of urine, let us take a look about composition of urine. It is mainly water. 93-96, it's water. The remaining 4 to 7% other organic and inorganic components. Urea, chloride, potassium, sulfate, phosphate, sodium, creatinine, ammonia, uric acid, calcium, magnesium. All these are components of urine. If any one of them higher than normal range, this indicates a condition, medical condition. We know that when we do urine analysis. Lastly, the question when we have to do a urine test. If the urine color is changing and persistently didn't come back to normal for a longer period, this time you have to go for medical check and make urine analysis, because if it is due to food or due to medication, of course when you stop medication it will go to normal. Food also will not stay persistently, will not stay long time. It will disappear the abnormal color and return back to the normal yellow color after few days. If we have persistent color change, we must go for medical check, because it can be hematuria, liver disease, kidney disease, urinary tract infection. All these serious conditions must be monitored and treated. At the end, thank you for watching the video. Also, I offer free medical consultation on my website. The link below the video. You visit the site, choose a proper article, then you put your question below the article as a comment. If you want to chat privately, also there is a chat there. You can click the icon, the chat icon, and send your question privately. Thank you again for watching. See you next video.